The Drug Enforcement Administration says overdose is the leading cause of death for adults 18 to 45, more than traffic accidents, more than cancer, more than gun violence. Last year, more than 110,000 people nationwide died from an overdose. To illustrate how bad it is here, on Tuesday alone this week, the King County Medical Examiner reported 6 overdose deaths ranging from heroin to cocaine to meth to fentanyl. More than 690 people have overdosed so far this year in King County. Snohomish County's opioid-related deaths hit an all-time high of 269 last year, with fentanyl involved in 95% of those cases. The county is set to launch a mobile opioid treatment program sometime this fall. A van with healthcare workers will travel parts of Highway 2 and 530, providing opioid addiction medication and other recovery services. The annual cost to keep the program going is around $900,000. 5 people were arrested recently in connection to trafficking fentanyl into Whatcom County for years. The Whatcom County Sheriff's Office identified and arrested the alleged kingpin, Mikel Escandon Tabilin, following a months-long investigation that started in May 2024. The Whatcom Gang and Drug Task Force recovered about 70 pounds of narcotics worth up to $1 million. The sheriff says the operation seized about 145,000 fentanyl pills trafficked from Snohomish County into Whatcom County. That's enough to give one pill to more than half the population of the county.
These drug dealers are coming into our communities and trying to hide and really make money on the backs of the deaths and the struggle of people. So we're certainly committed to finding those folks.
Investigators also uncovered evidence of a suspect using a 3D printer to manufacture untraceable ghost guns. They served a search warrant on the home of 34-year-old Austin Grimm of Bellingham, where they recovered the 3D printer that they say was used to manufacture automatic firearms. Homeland Security and the DEA played key roles in the big bust. I sat down with Dave Reames, the special agent in charge of the DEA Seattle office, for a wide-ranging conversation about guns, drugs, and how the cartels have shifted their business recently here in Western Washington. In a lot of these big busts we've seen, there's drugs, there's cash, and a lot of guns, and ghost guns especially. Why are we seeing so many ghost guns associated with drug trafficking?
Well, drug trafficking by its nature lends itself to violence. So traffickers use guns to protect themselves, they use guns to intimidate the competition, they use guns to protect their source of supply and their routes. So violence is sort of inherent in the program. And so ghost guns are just another evolution of that. With the advent of 3D printing, it's so easy to get a hold of guns, and that's one avenue they don't have to worry about. So buying a gun through a traditional means, there's a serial number, you have a buyer, you have someone you can point to as the purchaser. You don't have that with ghost guns. They can just be printed by someone at their house. So they're untraceable.
When I look at the things that are killing people from overdose, fentanyl, cocaine, I see methamphetamine right up there. Is methamphetamine still a huge problem here in Western Washington?
Methamphetamine is a crisis. It's a huge problem. If it weren't for fentanyl being so lethal, we'd be talking about the methamphetamine crisis right now. It's the same proportion. Fentanyl sort of overshadows it because fentanyl is so much more lethal, but we're seeing amounts of methamphetamine I've never seen before in my life. You don't have small home labs making methamphetamine anymore. It's all large-scale production facilities in Mexico creating very, very high purity methamphetamine. High 90s, 100% pure meth is what we're seeing today. We're hundreds of pounds of it. And not a week goes by we don't seize multiple pounds of methamphetamine.
He says one change they've seen from the cartels is how fentanyl is being trafficked. There are fewer pills on the streets, but more powder now. Powder that can be mixed in with other drugs or pressed into pills by local dealers. More dangerous in your mind?
It can be much more dangerous. Fentanyl is fentanyl, but powdered fentanyl, we're seeing purities rising into the 80s and 90%.
The cartels make the fentanyl for pennies on the dollar. So even if a pill is sold for 30 cents to $1, they're still making a sizable profit.
Those cartels make fentanyl in their laboratories in Mexico. So they can make as much as they want, as many chemicals as they buy. That's the amount of fentanyl they can make. There's no growing season. They can make as much as they want. So they have an economy of scale. They can produce it very cheaply and send it to the United States.
Are we seeing more cocaine trafficked into Washington?
Yes, we are. That is on track this year to be fairly substantially increased from last year. It's all money. It's all the Sinaloa cartel controls the trafficking routes. in the west coast of the United States. So up I-5 is Sinaloa cartel-controlled country. Back in June, we had a case with the Seattle police where we had a street-level buy of methamphetamine here about 18 months ago in Seattle. The investigators from DEA and the Seattle police tracked that methamphetamine back to the Sinaloa cartel and then back to Colombia, the producers of the cocaine that was a part of that organization. So on the June takedown, in Operation Red Rose was the name of the operation. In the June takedown, we arrested, Colombia National Police helped us, as well as other agencies here in town, arrested the producers, the distributors, the retailers here in the Seattle area, as well as the money launderers. We took the whole weed out from the root. So that's the sort of thing that Sinaloa cartel offers, is like a from beginning to end kind of control of the process. And that's what DEA is trying to fight against.
They're gearing up now to give out a large amount of school supplies and backpacks at student events where this DEA Hummer seized from a drug dealer and wrapped in their "one pill can kill" message will be on display.
It's impossible to really know what's in something you're taking. So don't trust anybody. If it's a friend giving you something, if it's a dealer selling you something, assume anything has fentanyl in it and could possibly kill you.